Good afternoon, Board of Directors of CVS. Thank you for giving us, our consulting firm, the opportunity to perform a strategic analysis on your company. Next slide, please. Our firm consists of myself. I am Dr. Michelle Arzubi-Hughes. I'm a pediatric emergency medicine physician. And I thought this was a great opportunity to add my knowledge of medicine into the strategic analysis. Lawrence?
My name is Terrence Mack. I'm a consultant for Guidehouse in their defense and security segment. I'm getting my MBA, and I graduated from William & Mary in 2016, and I'm working on my MBA now too.
My name is Lawrence. I'm an entrepreneur here in the Hampton Roads area. I'm also getting my MBA at William & Mary and projected to graduate here in December of 2023.
Hello, my name is Minu McDonald. I am currently working for a nonprofit hospital organization. I am their imaging manager for their diagnostic center. I too am part of the William & Mary MBA program with my team.
My name is Mike Tomaino. I've been in the chemical manufacturing industry for about 8 years, done some production engineering operations, and now I'm in information technology. Like the rest of my team, I'm pursuing an MBA with William & Mary.
I'll start our group off. CVS's mission. As a company, CVS runs more than 1,100 walk-in health clinics and manages prescription drug benefits for over 94 million people. CVS's corporate mission is to help people on their path to better health. This mission statement is based on the company's value proposition that involves products used to improve or maintain target consumers' health. CVS's business purpose, business nature, and value proposition relate to the same competitive advantages suited to the retail, pharmacy, and healthcare industries. And a manifestation of CVS's mission statement is the strategic objective of focusing on products that directly relate to customers' healthcare needs. Together with their vision statement and mission statement, they emphasize the customer-centric approach of company strategy, putting the enterprise as a supporting factor for consumers' good health. As a team, we have concluded CVS is an integrated health and wellness company with a strong brand identity and significant market share in the pharmacy, primary care, and health insurance industries. The company's main objectives are putting people first, rising to the challenge, joining forces through effective collaboration, simplification, and inspiring trust, and most importantly, championing safety and quality. Existing business strategies currently being utilized by CVS Group include making bold shifts, advancing primary care delivery, creating community health designations, diversifying growth, enhancing omni-channel experiences, and driving a digital-first approach. As a pharmacy, CVS operates both in-store and online, servicing drug benefits to over 94 million people. The in-store pharmacy design experiences higher barriers to entry into the market for competitors that the e-pharmacy space does not experience, which is why so many new e-pharmacy brands have developed within the past few years. There's a continual uptick in this competitive e-pharmacy space, which CVS must address in continuing its business and brand into the future.
So the retail sector here, and we're separating this from the pharmacy sector that Terrence just spoke about. We're talking about the front store CVS here, where you sell cosmetics, food, drinks, and convenience items. And as a whole, this sector's in decline, or at best, it's not growing. However, CVS has been less affected by this slowing of growth or decline than others. In fact, in your annual report in 2022, we saw that front store retail grew and actually outperformed estimates. And we can thank customer demographics for this. the in-store customer base is generally older generation Americans who are slower to adopt e-commerce and digital solutions. Another benefit for CVS here is the fact that the front store is attached to the pharmacy and the minute clinics. This generates more accessory sales because there are more reasons to bring people into the stores in the first place. If you compare this to other locations competing in the retail space that don't have this benefit, you're going to see better performance. And as we'll get to later in our strategy recommendations, we think we can exploit this advantage by expanding in-store healthcare options. One last thing to note here is that CVS's retail market share has gone up, but that's not necessarily a good sign, not necessarily a bad sign, but an increase of a market share in a declining industry could mean that others are exiting the industry earlier than CVS. So retail sector performance should be monitored carefully, and CVS's exposure in this area may still be a long-term threat based on overall industry trends. Then we can move on to the next slide to talk about the health insurance industry. By acquiring Aetna, CVS has gained significant exposure to the health insurance industry. Essentially overnight, CVS Health went from not providing insurance to being the 6th largest health insurance provider in the US. Overall, this industry is characterized by consolidation. The 2 leading insurance providers are good examples. United Health Group, which commands an industry-leading 15% market share, is a multinational conglomerate that's grown over time. And the second largest firm, Anthem, controls 10% market share after a merger with Blue Cross Blue Shield. CVS Health / Aetna has 3.6% market share, but is more integrated into other markets than its competitors, like with having healthcare options in store and a pharmacy. So this gives an advantage to CVS in terms of vertical integration that we may be able to exploit. Another key characteristic of this industry is its subjectivity to legislation, regulation, and political policy. So coupled with the increasing cost of medical care, which are complex issues that Michelle or Minu would probably have more expertise weighing in on. But if we look at all this together, what we're seeing is insurance providers experiencing currently relatively low profit margins and also decreasing profit margins. So in 2022, industry profit margins decreased from 3.7 to 3.4. Because of this, the exposure to the insurance industry for CVS may only be beneficial. It's only beneficial to you if you can capitalize on your unique integration with pharmacy and healthcare services. And overall success in this industry may depend on the ability to navigate and predict the changes in the regulatory environment and the competitive landscape that may arise due to basically changing laws and the emergence of different public health insurance options. Wasn't sure, Minu or Michelle, if you wanted to add anything on insurance here before we move to the next.
Yeah, I briefly just wanted to add that I think this would not only be beneficial for CVS, but the forming a tight relationship with the insurance industry. This will be beneficial to them as well, because it would minimize costs, especially for preventing going to the emergency department or urgent cares, which those costs can become quite astronomical. So playing a better role in preventative care, I think would be key. Thank you.
That's actually Yeah, thank you, Michelle. It's actually a great segue into the next industry, which is the health services industry that CVS plays in. So we can move to the next slide. And as we know, CVS began as a pharmacy, but you were unique in being the first major pharmacy to offer in-store health services. So this is Minute Clinic, providing walk-in healthcare services for illnesses, infections, and injury, flu shots, other seasonal services, and all that. And as Michelle mentioned, it's a low-cost option. It's an option for people in their community to get quick care for what they need at a reasonable cost. And this industry overall, the healthcare services industry, is characterized by trends towards specialization, personalization, and telehealth, and I guess overall convenience for the consumer. So as technology has improved, so has the access to information, and coupling that with the increased costs for healthcare, this has driven consumers to manage a lot of standard health issues more independently. And it's causing them to want to visit clinics less, wanting to visit primary care providers less, and seeking more convenient, lower cost options. So the industry trends favor CVS in this case, as more consumers want this convenience and this community option. Success in this industry is going to be defined by an organization's ability to provide that specialized, personalized, and convenient care, which Minute Clinic is, we think, uniquely positioned to do. And as we mentioned previously when discussing health insurance, we think CVS should be able to benefit from this integrated portfolio, reducing overall costs due to their vertical integration. So our strategy recommendations to follow will attempt to capitalize on all these trends by suggesting diversification of in-store health services and investment in more advanced personal healthcare, like wearable technology, implants, and more convenient digital services. So we'll get there later. And that's it on healthcare.
All right. So how does CVS win and move into the future with their competitors? So we have three major recommendations for them. The first is going to be to expand globally. We think that they need to start with e-pharmacy services. This will greatly cut down on the cost of fully moving into foreign markets, but this will still give them access to markets which can greatly increase revenue. And like I said before, it will cut down on the brick and mortar stores that CVS is used to. The first is we think that they should move into the Canada market, Canadian, but they are most similar to American rules and regulations, and tend to be an easy transition for companies who have traditionally done most of their business in the United States. The second recommendation would then be to move into the UK or European markets. Again, UK is very business friendly typically. And again, culture styles, business styles, and trends tend to follow the same pattern within all of the Western communities. And then we also recommend that they move into the South American market. They currently have made a slight adjustment to move into areas like Puerto Rico, but as of now, that's kind of American territory. And they've got some space in Brazil. But again, we suggest that they be more aggressive, as their competitors have been, into moving into some of these South American markets, as well as the fact that these markets usually have looser or at least easier, rules and regulations when it comes to what you need to do in order to properly conduct business there. Our second recommendation was going to be to invest in technological advances. Most of this is going to come through online services. So CVS has new competitors such as Cost Plus, who's kind of revolutionized the industry by, combining low-cost prescription drugs with the convenience of direct delivery. So they have grabbed a huge market share right off the bat just from, their innovation. A lot of CVS's competitors are kind of moving in the same direction. And while CVS does do a significant amount of business online, we're suggesting that they kind of expand their ability of what they're doing online and kind of incorporate what Cost Plus Drugs is doing into their strategy. And then lastly, we are suggesting that they expand their in-pharmacy services. And this is going to be from the physician's end. So our recommendation is that they either partner with like a physician's group or some kind of organization similar to that, and just kind of expand the services that they provide in their stores. As Mike was saying earlier, part of there's the success of their retail store is the fact that they can actually get customers to come into their location in order to begin, the purchasing of their prescriptions or whatever, which may lead to the success of their front store. And this would just be an extension of that. If they can get, customers to come in for more of these physician type services, then it leads to, more business across the platform. And that's pretty much our main recommendations. If anybody else has anything they want to add, please do so. All right, we can move on to the next slide. So right now, CVS is doing a good plan. They've got a strong strategy. Everything that they're doing seems to be working. Out of all the research that we saw, the only recommendation we could give them was to maybe hone in a little bit more on their financial strategy. Some of the recommendations that we're making are going to require being on top of their finances and really is going to require a huge financial investment. So moving forward, they will need to make sure that they stay on top of that. But other than that, they're doing pretty well. Next slide. I think you can move on to the next slide.
All right, thank you so much, Lawrence. Now, just to expand a little bit more on what Lawrence was talking about, one of our biggest strategic move that we suggest for CVS would be to expand globally. Currently, as he had mentioned, the only global expansion they have is Puerto Rico, which again is part of the United States. We do believe that CVS should aggressively expand globally to secure available market shares in foreign markets. As Lawrence had mentioned, the 4 markets that seem to be most attractive are Canada, Europe, South America, and Asia. We do believe CVS should be developing an international expansion roadmap, starting with Canada and then continuing to the other 3 locations. One of the things that we do believe could help financially would be to start with the e-pharmacy services versus going straight to brick and mortar. That will cut cost on actual physical cost of the brick and mortar stores. Plus, with all the technological advancements, e-pharmacy services seems to be the way most people are going globally as well. So this is definitely an aggressive move. And mentioned before, finances need to be really looking at because expanding, internally it takes a lot of money, especially if you're looking at it globally. It's going to be quite significant as well. However, CVS does need to penetrate the global market for sure. One of the biggest competitors that CVS currently has is Walgreens, and they have been expanding globally. So in order to stay within that competitive market, we need to be able to be competitive in that global market as well. If we can go to the next slide, please. Let's see. So a couple of our external opportunities. Right now, 33% of the healthcare products are sold online, will be sold online by 2025. So therefore, again, having that e-pharmacy would be beneficial. The pharmacy markets in Canada and Mexico are expected to grow over 5% throughout the next years up to 2028. A couple of the key internal weaknesses CVS does have, which we would need to focus on, would be currently the company depends primarily on the U.S. healthcare and retail industry, so limiting, again, as mentioned, that international involvement. Also, financially looking at into the finance, CVS has underperformed by 40% in the S&P 500. Hopefully expanding globally will turn that around so that we can see an improvement in that. Next slide, please. So our third recommendation for CVS is to increase their medical care capabilities within their pharmacies, as mentioned before by Mike and Lawrence. which may require them to create mergers with different medical groups to help them provide the needed medical services. Overall, their goal should be the ability to offer physical medical care to their customers who may end up relying on CVS for medical attention and primary care. Many customers are replacing their primary care doctors with visits to facilities such as MedExpress and other similar organizations that are offering open care to patients in need. By expanding its physician care capabilities, CVS can obtain a significant share of the medical service market using their existing customer base. As Mike had mentioned, our prediction is that the results for the future benefits will be based on prior diversification such as Aetna. So we saw a significant market share in the health insurance industry, and hopefully expanding in the primary care services, we will see the same results as we did with Aetna. And off to Michelle.
All right, thank you, Minu.
Sure.
By using, just so you have an idea of what we did to do the strategic analysis, we used the SWOT matrix. We did obviously internal factor matrix, external factor, and we also used a space matrix to give us an idea of where we're at. And by analyzing CVS's internal strengths with the external opportunities that are going on, we realized that there's a strong market to capture these customers and or patients by expanding the inpatient or in-pharmacy care services. People tend to go to the pharmacy before they go to the doctor. They want to go and see what they can find over the counter. So if they go in and there's a physician or nurse practitioner or whatever, but there's a clinic, that will presents a perfect opportunity to see more patients and customers. And then you also have the retail side because they'll have to pick up toilet paper and tissues. So it's a great place to capture more customers. And it might eliminate a potential future step of going to an urgent care in the emergency department because they see a physician or advanced practice provider in the pharmacy itself. People are busy and often they want something much more efficient, and going to a pharmacy does that. And CVS is in a perfect position to provide them that opportunity. Please continue to the next slide. So continuing with convenience and expediting care, telehealth, especially during the COVID pandemic, but there was a huge need for that. And there needs to be continuity, especially for people that live in rural areas. So CVS could invest in making an app to not only order whatever over-the-counter medications, or if they're physician, or if they need to continue prescription medications, but you could have telehealth on the palm of your hand. Make an app where you can easily access an advanced practice provider or a physician at the same time. And while you're at it, you can also order retail and have it quickly delivered to your home as well. And this doesn't just help the people that need some expedited care because they're working, but it helps for those who are elderly and are unable to leave their homes or have other medical or physical disabilities. So applying these types of product correspond with the aggressive strategy quadrant that we found when we did the space matrix analysis. And CVS is in a hugely strong position to take risks and take a lead in this industry. So please continue to the next slide. The telemedicine or telehealth model is a helpful model for those, like I had described before. And with this acquisition, with CVS's acquisition of Aetna, this is up an excellent opportunity, like I mentioned before, to continue to help the insurance companies as well to make a profit. And CVS makes a profit by combining this market with the health insurance, because health insurance, if they don't have to pay for the expensive emergency department visits or urgent care visits, they are going to definitely pounce on this opportunity, which CVS can really take a market on. And you can see that in non-emergent situations, 1 in 3 Americans would rather go to a pharmacy rather than going to the long line or the waiting area, or where there's other sick people in urgent care and emergency department facilities. And you can see the acquisition of Aetna increased the size of CVS by 100%. So this puts, like I will say again, puts CVS in a very aggressive opportunity. Please continue to the final slide. So in summary, CVS is in a strong position to expand their market internationally, advance technologically, and as a physician myself, I support expanding medical care within CVS to help customer and patients expedite the care. Thank you for your time. Please, if you have any questions, reach out to us and we'll be more than happy to help. And if we continue with the slides, you can see our references. We have more pages of references. Thank you very much.
Thank you.
Thanks, everyone.
Thank you.
Yeah.